Hello guys, Dr. Fatma Qureshi here, and today I will be talking about vitreous floaters. Vitreous floaters is something that a lot of you have asked me about, whether it's here in the comment section or in the exam room. And you guys come in with different kinds of symptoms. Some of my patients describe it as seeing little threads floating around. Sometimes they describe it as like a fly that they're seeing or a cobweb, something like that along those lines. So basically a vitreous floater is also known as posterior vitreous detachment, and today I'm going to show it to you on an eye model, and I feel like that way you're going to understand the concept of a vitreous floater and whether it's a dangerous thing or a complication or something that I just have to monitor. Okay, so I am going to show you my eye model, which is this one. And if you see here, I'm going to point it with my pen. This is the anatomy of the human eye, and you can see this area which is known, I'm pointing it with my pen, which is known as vitreous body. This whole area is supposed to be a thick gel-like consistency. So if you look in the front, this is the front part of the human eye where you can see the lens, the pupil, and the cornea. And then this is as we approach the back part of the eye. So this is where the optic nerve is, and this is where the macula is. But this whole area, as you can see here, it says vitreous body. It's supposed to be a thick gel-like consistency, and it keeps the retina intact. So basically what it does is it protects our retina from getting detached. That's nature's way or God's way of protecting our human eye. But if you see some floaters floating around occasionally, it's not a bad sign. But if you see hundreds of floaters along with flashes of lights in the periphery or a black curtain or shadow in the field of view, then definitely you have to contact us, because that becomes a medical emergency. It could be leading to a retinal detachment. So again, if you see occasional floaters, not a bad sign. I see them in this kind of white light, but I just, have lived with them. A lot of patients just get used to them, or seeing them on a regular basis becomes the norm for them. But like I said, if you see hundreds of floaters, the whole concept is that the floaters have to be a lot, hundreds of them, not going away, not being off and on, but just constantly being in the eyes. And then you also have flashes of lights in the periphery. 100% you have to come in and see us. And then most likely I'm going to refer you to a retina specialist after doing the fundus photos, which, as you all know, is something that is documented, and also is something with which I can educate the patient with. And another thing is, if you see a floater occasionally, and you just monitor it yourself, but if you feel like you are getting anxious about it, or you want to make sure, just in case, everything is okay in the back of your eye, definitely get a dilated eye exam so that I can see where the floaters are. They float around. Sometimes it could be just sitting in one area, but most of the times they do float around. If it bothers some patients to the point where they say, "Doc, I cannot live with it, it's just affecting my vision a whole lot," then in those instances I have referred them to a retina specialist, where they do a procedure which is known as vitrectomy, and that means that they can remove the floaters. It does come with some complications. As always, every surgery comes with complications. It doesn't mean that the complications are happening, but it can potentially have complications. So just keep that in the back of your mind. Remember, vitreous floaters or PVD, and this is something that is seen a lot in my patients, and I always dilate my patients just to make sure the retina is intact. And sometimes if the floaters are bothering the patients a lot, then I also ask them to come back for a follow-up, maybe like in a month or even in a few weeks, just to make sure everything is looking exactly what it did before. But if I see any chances or any changes in the retina for that matter, then absolutely I am going to refer them to a retina specialist. Okay, you guys have a great day. Bye.